Question 1. System analysis indicates that a registered clinical exercise physiologist (RCEP) is seeking to enhance their professional practice and expand their network within the clinical exercise physiology community. Considering the RCEP commitment to evidence-based practice and client-centered care, which of the following strategies best optimizes professional development and collaborative opportunities while adhering to ethical guidelines? Option A. Wait for invitations to join committees or participate in professional events, and only engage with colleagues when direct client referrals are anticipated. Option B. Primarily rely on informal social media connections to discover potential collaborators and learning opportunities, without formal engagement with established professional bodies. Option C. Focus exclusively on building a personal brand and client base through self-promotion, with minimal investment in external professional development or organizational involvement. Option D. Actively seek membership and participation in relevant professional organizations, attend their conferences and workshops, and engage in peer-to-peer consultation with other RCEP and allied health professionals. The correct answer is D. Actively seek membership and participation in relevant professional organizations, attend their conferences and workshops, and engage in peer-to-peer consultation with other RCEP and allied health professionals. Explanation. The scenario presents a common professional challenge for a registered clinical exercise physiologist (RCEP), where they need to leverage their professional network to enhance their practice and client care. The challenge lies in identifying and engaging with relevant professional organizations and individuals in a manner that is both effective and ethically sound, adhering to the RCEP scope of practice and professional conduct guidelines. This requires strategic thinking about how to build and maintain relationships that support professional growth and client well-being, without compromising professional integrity or patient confidentiality. The correct approach emphasizes proactive and ethical engagement with professional organizations and colleagues. This aligns with the RCEP commitment to lifelong learning, evidence-based practice, and interprofessional collaboration, all of which are implicitly or explicitly supported by professional standards and ethical codes governing RCEP. By actively participating in relevant professional bodies, attending conferences, and engaging in peer consultation, an RCEP demonstrates a dedication to staying current with best practices and expanding their knowledge base, ultimately benefiting their clients. This also fosters a supportive professional community that can offer guidance and shared learning opportunities. Incorrect approaches fail to uphold the professional standards expected of an RCEP. One incorrect approach might involve passively waiting for opportunities to arise, which limits professional development and the ability to contribute to the field. Another incorrect approach could involve seeking connections solely for personal gain or without regard for professional boundaries, potentially leading to conflicts of interest or breaches of confidentiality. A third incorrect approach might involve neglecting to engage with professional organizations altogether, which can lead to professional isolation and a lack of awareness of evolving standards and research, thereby potentially impacting the quality of care provided. These failures represent a departure from the ethical obligations of an RCEP to maintain competence, act with integrity, and prioritize client welfare. Professional decision-making in such situations should involve a systematic process of evaluating potential networking strategies against established professional standards and ethical principles. This includes identifying relevant professional organizations that align with the RCEP practice area, assessing the value of membership and participation, and determining appropriate methods for professional engagement that respect client privacy and avoid conflicts of interest. Professionals should prioritize activities that enhance their knowledge, skills, and professional network in a way that directly supports their ability to provide high-quality, evidence-based clinical exercise physiology services. Question 2. Risk assessment procedures indicate that a client diagnosed with stage II chronic kidney disease, CKD, presents with significant fatigue, reduced exercise tolerance, and mild peripheral edema. The client's glomerular filtration rate, GFR, is consistently below 45 ml/min/1, 73 m2. Considering the pathophysiological implications of CKD on exercise capacity, which of the following approaches is most appropriate for developing an exercise intervention? Option A. Advise the client to significantly reduce their physical activity to conserve energy and prevent further strain on their kidneys. Option B. Design an exercise program that emphasizes moderate-intensity aerobic activity and progressive resistance training, focusing on improving cardiovascular endurance and muscular strength, while closely monitoring for signs of overexertion and fluid imbalance. Option C. Recommend a high-intensity interval training (HIIT) program to rapidly improve cardiovascular fitness, as this is generally effective for most individuals. Option D. Prescribe a specific low-sodium diet and recommend over-the-counter diuretics to manage fluid retention before initiating any exercise. The correct answer is B. Design an exercise program that emphasizes moderate-intensity aerobic activity and progressive resistance training, focusing on improving cardiovascular endurance and muscular strength, while closely monitoring for signs of overexertion and fluid imbalance. Explanation: this scenario presents a professionally challenging situation because the registered clinical exercise physiologist, RCEP, must integrate complex pathophysiological knowledge of chronic diseases with the practicalities of client care and regulatory compliance. The challenge lies in accurately interpreting the client's condition, understanding the implications of their specific chronic disease for exercise prescription, and ensuring that the chosen intervention aligns with the RCEP scope of practice and relevant professional guidelines. Careful judgment is required to avoid overstepping boundaries, providing inappropriate advice, or failing to recognize when referral to another healthcare professional is necessary. The correct approach represents best professional practice because it prioritizes client safety and evidence-based care. By focusing on the specific pathophysiological mechanisms of the client's chronic disease, e.g., impaired glucose regulation in type 2 diabetes mellitus, altered cardiac function in heart failure, the RCEP can tailor exercise interventions to address the underlying disease processes and their impact on functional capacity. This aligns with the RCEP role in developing and implementing exercise programs for individuals with chronic conditions, as outlined by professional standards and ethical codes that emphasize individualized care and the application of scientific principles. An incorrect approach that involves solely focusing on general fitness improvements without considering the specific pathophysiology of the chronic disease is professionally unacceptable. This fails to acknowledge the unique needs and potential risks associated with the client's condition, potentially leading to ineffective or even harmful exercise prescriptions. May also represent a failure to adhere to professional standards that mandate a thorough understanding of the client's medical history and its implications for exercise. Another incorrect approach, such as recommending specific dietary changes or pharmaceutical interventions, falls outside the RCEP scope of practice. This constitutes a regulatory and ethical failure, as it encroaches upon the domains of registered dietitians or physicians. Such actions could lead to adverse health outcomes for the client and expose the RCEP to professional liability. A professional reasoning framework for similar situations should involve a systematic process. 1. Thorough client assessment, including a detailed medical history, review of current medications, and understanding of the diagnosed chronic disease and its pathophysiological underpinnings. 2. Identification of exercise contraindications and precautions directly related to the client's specific condition. 3. Development of an individualized exercise plan that targets specific physiological impairments and functional limitations, grounded in scientific evidence for managing the chronic disease. 4. Continuous monitoring of the client's response to exercise and adjustment of the program as needed. 5. Clear communication with the client and, when appropriate, with their other healthcare providers, including timely referral for specialized care when the client's needs exceed the RCEP expertise or scope of practice. Question 3. Process analysis reveals a client undergoing a supervised exercise program for cardiovascular health reports a new onset of sharp, localized knee pain during the eccentric phase of a specific lower body exercise, which was not present in previous sessions. The client denies any recent trauma or falls. The RCEP has reviewed the client's initial assessment and program, which did not identify any pre-existing knee pathology. What is the most appropriate immediate course of action for the registered clinical exercise physiologist? Option A. Immediately discontinue all lower body exercises and focus solely on upper body and cardiovascular training. Option B. Advise the client to reduce the intensity and volume of the exercise program and continue with modified exercises. Option C. Instruct the client to continue with the current exercise program and encourage them to push through the pain, as it may be muscular soreness. Option D. Recommend a referral to a physician or physical therapist for further evaluation of the knee pain before continuing the current exercise program. The correct answer is D. Recommend a referral to a physician or physical therapist for further evaluation of the knee pain before continuing the current exercise program. Explanation. This scenario presents a professional challenge because the registered clinical exercise physiologist (RCEP) must balance the client's subjective report of pain with objective findings and established clinical guidelines for exercise prescription. The RCEP needs to make an informed decision about modifying an exercise program that could potentially exacerbate an underlying musculoskeletal issue, while also ensuring the client continues to benefit from exercise. Careful judgment is required to avoid both undertreatment, leading to misdiagnosis or delayed recovery, and overtreatment, leading to unnecessary fear avoidance and deconditioning. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based assessment to identify the root cause of the client's pain. This aligns with the RCEP scope of practice, which includes assessing and managing exercise for individuals with musculoskeletal conditions. By recommending a referral to a physician or physical therapist, the RCEP is acting within their professional boundaries, ensuring the client receives appropriate medical evaluation for a potentially undiagnosed or worsening condition. This also upholds ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by seeking expert opinion to guide safe and effective exercise. Regulatory frameworks for RCEP emphasize the importance of recognizing limitations and collaborating with other healthcare professionals when a client's condition falls outside the RCEP direct management scope. An incorrect approach that involves simply reducing the intensity or volume of exercises without further investigation is professionally unacceptable. This fails to address the underlying cause of the pain and could lead to a false sense of security while the condition progresses. It also risks promoting fear avoidance behavior, where the client becomes hesitant to engage in exercise due to unresolved pain, hindering long-term adherence and functional improvement. Ethically, this approach could be seen as a failure to adequately assess and manage the client's condition, potentially violating the duty of care. Another incorrect approach, such as continuing the current program and advising the client to push through the pain, is highly dangerous and ethically reprehensible. This directly contradicts the principle of non-maleficence and could lead to significant injury, delayed healing, and increased pain. It demonstrates a severe lack of clinical judgment and a disregard for established exercise science principles regarding pain management and injury prevention. Regulatory bodies would view this as a serious breach of professional conduct. A third incorrect approach, which is to immediately discontinue all exercise, is also professionally problematic. While caution is warranted, a complete cessation of exercise without a thorough assessment and medical referral may be overly restrictive and lead to deconditioning, negatively impacting the client's overall health and well-being. This approach may not be the most beneficial course of action and could be perceived as an overreaction without sufficient diagnostic information. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly assess the client's subjective report of pain, including its characteristics, onset, and aggravating/alleviating factors. 2. Conduct objective assessments to evaluate range of motion, strength, posture, and movement patterns related to the reported pain. 3. Compare current findings with previous assessments and established clinical guidelines. 4. If the pain is new, worsening, or suggestive of a significant underlying issue, prioritize referral to a physician or physical therapist for definitive diagnosis and management. 5. While awaiting referral or diagnosis, modify the exercise program to avoid aggravating the pain, focusing on exercises that are pain-free and support overall function. 6. Maintain open communication with the client and the referring healthcare professional. Question 4. Governance review demonstrates a need to clarify the distinct contributions of a registered clinical exercise physiologist, RCEP, within a hospital's cardiac rehabilitation program, particularly in relation to the roles of cardiologists, nurses, and physical therapists. Which of the following best articulates the unique impact and scope of the RCEP in this setting? Option A. The RCEP contribution is primarily in patient education regarding general healthy lifestyle choices, including diet and stress management, without specific emphasis on exercise physiology principles. Option B. The RCEP primary impact lies in conducting comprehensive exercise assessments, designing individualized exercise prescriptions for patients with cardiovascular disease, and monitoring their response to exercise intervention, thereby optimizing functional capacity and reducing cardiovascular risk. Option C. The RCEP role is to manage all patient medication adjustments and interpret complex electrocardiogram (ECG) readings to determine the necessity of further cardiac interventions. Option D. The RCEP focus is on providing manual therapy techniques to improve joint mobility and alleviate pain associated with deconditioning, as well as administering intravenous medications as prescribed by the physician. The correct answer is B. The RCEP primary impact lies in conducting comprehensive exercise assessments, designing individualized exercise prescriptions for patients with cardiovascular disease, and monitoring their response to exercise interventions, thereby optimizing functional capacity and reducing cardiovascular risk. Explanation. This scenario presents a professional challenge due to the need to clearly delineate the scope of practice for a registered clinical exercise physiologist (RCEP) within a multidisciplinary healthcare setting. The RCEP role, while focused on exercise, intersects with other health professions, requiring a precise understanding of boundaries to ensure patient safety, avoid scope of practice violations, and maintain professional integrity. Careful judgment is required to identify the unique contributions of clinical exercise physiology and distinguish them from the responsibilities of other allied health professionals. The correct approach represents best professional practice because it accurately reflects the RCEP-defined scope of practice as established by relevant professional bodies and regulatory frameworks governing RCEP. This involves a deep understanding of the scientific principles of exercise physiology and their application to the prevention, treatment, and management of chronic diseases and health conditions. It emphasizes the RCEP expertise in exercise assessment, prescription, and program design tailored to individual needs, often in collaboration with physicians and other healthcare providers. This approach upholds the RCEP professional autonomy and ensures that patient care is delivered by appropriately qualified individuals within their designated competencies, aligning with ethical guidelines and regulatory requirements for RCEP. Incorrect approaches fail to uphold professional standards and may lead to regulatory or ethical violations. One incorrect approach might involve assuming responsibilities that fall solely within the purview of a physician, such as diagnosing medical conditions or prescribing pharmacological interventions. This constitutes a scope of practice violation and an ethical breach, as it exceeds the RCEP training and licensure. Another incorrect approach could be to perform interventions that are the primary domain of a physical therapist, such as manual therapy or extensive rehabilitation for acute musculoskeletal injuries, without appropriate referral or collaboration. This also represents a scope of practice infringement and a failure to respect the expertise of other allied health professionals. A further incorrect approach might be to provide general wellness advice without considering the clinical context or the patient's underlying health conditions, thereby failing to leverage the specialized clinical knowledge of an RCEP and potentially offering suboptimal or even harmful recommendations. These failures undermine patient trust, compromise care quality, and expose the RCEP to professional sanctions. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's needs, the RCEP scope of practice, and the roles of other healthcare professionals. This includes consulting relevant professional standards, ethical codes, and legal regulations. When in doubt, seeking clarification from supervisors, mentors, or professional organizations is crucial. The RCEP must prioritize patient safety and well-being, ensuring that all interventions are evidence-based, within their competence, and appropriately integrated into the overall patient care plan. Question 5. The audit findings indicate a client's recent diagnosis of a significant cardiovascular condition, which was not present at the initial assessment. The client expresses a strong desire to continue their current exercise program as prescribed by the Registered Clinical Exercise Physiologist, RCEP. Considering the RCEP role in managing exercise for individuals with clinical conditions, what is the most appropriate course of action? Option A. Continue the existing exercise program as planned, reassuring the client that exercise is generally beneficial and that the new diagnosis is unlikely to significantly impact their current regimen. Option B. Advise the client to cease all exercise activities immediately until further notice, without consulting the referring physician or conducting a new assessment. Option C. Immediately consult with the client's referring physician to discuss the new diagnosis and its implications for the current exercise program, and collaboratively determine necessary modifications or a revised plan. Option D. Proceed with the current exercise program, but instruct the client to self-monitor for any adverse symptoms and report them if they occur, without further professional intervention or physician consultation. The correct answer is C. Immediately consult with the client's referring physician to discuss the new diagnosis and its implications for the current exercise program, and collaboratively determine necessary modifications or a revised plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the registered clinical exercise physiologist (RCEP) to navigate a situation where a client's medical status has changed significantly, impacting the safety and efficacy of their prescribed exercise program. The RCEP must balance the client's desire to continue exercising with their duty of care and the need to ensure the exercise program remains appropriate and safe, adhering to professional standards and potentially regulatory requirements for scope of practice and client management. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing client safety and evidence-based decision-making. It involves a comprehensive reassessment of the client's condition, consultation with the referring physician, and modification of the exercise program based on the new medical information and professional guidelines. This aligns with the RCEP ethical responsibility to practice within their scope, ensure client well-being, and maintain collaborative relationships with other healthcare professionals. The RCEP role is to integrate exercise physiology expertise with the client's overall health status, necessitating this thorough and collaborative approach. Incorrect approaches analysis. One incorrect approach involves continuing the existing exercise program without modification or further assessment. This fails to acknowledge the RCEP ethical and professional obligation to adapt interventions based on changes in a client's health status. It could lead to adverse events, contravention of professional standards of care, and potentially violate guidelines regarding client safety and appropriate exercise prescription. Another incorrect approach is to unilaterally discontinue all exercise without consulting the client or the referring physician. Caution is warranted. An abrupt cessation without a clear, evidence-based rationale and collaborative discussion can undermine client autonomy and the therapeutic relationship. It may also overstep the RCEP role if the physician believes some form of exercise remains beneficial and safe under specific conditions. A third incorrect approach is to dismiss the new medical information as irrelevant to the exercise program. This demonstrates a failure to appreciate the interconnectedness of a client's health and their exercise capacity. It disregards the potential for the new condition to impact exercise tolerance, safety, or the overall effectiveness of the intervention, thereby failing to uphold the RCEP duty of care and professional responsibility. Professional reasoning. Professionals should employ a systematic decision-making process that begins with recognizing the significance of new information. This involves a thorough assessment of the client's current status, a review of relevant literature and professional guidelines, and consultation with other healthcare providers when necessary. The RCEP must then integrate this information to make an informed decision about the appropriate course of action, always prioritizing client safety and well-being, while acting within their scope of practice and ethical obligations. Question 6. The monitoring system demonstrates a consistent heart rate response within the predicted target zone for the prescribed exercise intensity. However, the client reports experiencing significant dyspnea and fatigue. Which of the following approaches best reflects the RCEP professional responsibility in this situation? Option A. Advise the client to push through the discomfort as it is a normal part of exercise adaptation. Option B. Reduce the exercise intensity solely based on the subjective report without further investigation. Option C. Continue with the prescribed exercise intensity as the objective data indicates it is within the safe range. Option D. Immediately terminate the exercise test and reassess the client's subjective and objective responses to determine the appropriate next steps. The correct answer is C. Continue with the prescribed exercise intensity as the objective data indicates it is within the safe range. Explanation. This scenario presents a professional challenge due to the potential for misinterpreting exercise test data, which can lead to inappropriate exercise prescriptions and negatively impact client outcomes. The registered clinical exercise physiologist, RCEP, must exercise careful judgment to ensure the safety and efficacy of the exercise intervention. The correct approach represents best professional practice because it aligns with the RCEP ethical obligation to provide evidence-based care and to act within their scope of practice. Specifically, it emphasizes the importance of a comprehensive assessment that integrates multiple data points, including subjective client feedback and objective physiological measures, to inform the exercise prescription. This approach adheres to the principles of client-centered care and risk management, ensuring that the exercise plan is tailored to the individual's current capabilities and limitations, thereby minimizing the risk of adverse events and maximizing the potential for positive adaptations. An incorrect approach that relies solely on a single objective measure without considering the client's subjective experience or other relevant physiological parameters is professionally unacceptable. This failure constitutes a breach of professional standards by potentially oversimplifying a complex physiological response and neglecting crucial individual variability. Such an approach could lead to an exercise prescription that is either too strenuous, increasing the risk of injury or overexertion, or too conservative, limiting the client's progress and potential benefits. This also represents a failure to adhere to the RCEP responsibility to conduct a thorough and individualized assessment, as mandated by professional guidelines that stress the importance of a holistic evaluation. Another incorrect approach that ignores the client's reported symptoms during the test, despite objective data suggesting otherwise, is also professionally unacceptable. This disregard for subjective reporting can lead to a dangerous underestimation of the client's physiological stress response. It violates the ethical principle of beneficence, as it fails to prioritize the client's well-being and safety. Furthermore, it demonstrates a lack of critical thinking and clinical reasoning, essential components of competent practice for an RCEP. The professional reasoning process for similar situations should involve a systematic evaluation of all available data. This includes objectively assessing physiological responses, actively listening to and valuing the client's subjective feedback, and considering the client's medical history and any contraindications. The RCEP must then synthesize this information to make an informed decision about the appropriate exercise intensity and duration, always prioritizing client safety and individual needs. This iterative process of assessment, interpretation, and prescription, with ongoing monitoring and adjustment, is fundamental to effective clinical exercise physiology practice. Question 7. Market research demonstrates that clients often seek to understand the why behind their physical discomfort and the rationale for prescribed exercise interventions. A client presents with persistent localized muscle pain during specific movements, reporting that they have been told their muscle fibers are not firing correctly. As a registered clinical exercise physiologist, RCEP, how should you best address this client's concern and develop an appropriate intervention plan, considering the structure and function of muscles? Option A. Provide a generic, standardized exercise routine for general muscle strengthening, without inquiring about the specific nature of their pain or the movements that elicit it. Option B. Explain the role of muscle fibers, sarcomeres, and the neuromuscular junction in force production and movement, and how these components can be affected by disuse or injury. Then design a progressive exercise program targeting the affected musculature to improve strength, endurance, and neuromuscular control. Option C. Advise the client that their pain is likely psychosomatic and suggest they focus on stress management techniques, offering no specific exercise-based recommendations. Option D. Immediately recommend a specific advanced manual therapy technique that you have observed to be effective for similar pain presentations, without further assessment or consideration of your scope of practice. The correct answer is B. Explain the role of muscle fibers, sarcomeres, and the neuromuscular junction in force production and movement, and how these components can be affected by disuse or injury. Then design a progressive exercise program targeting the affected musculature to improve strength, endurance, and neuromuscular control. Explanation. Scenario analysis. This scenario presents a challenge for a registered clinical exercise physiologist (RCEP), as it requires them to translate complex physiological knowledge about muscle structure and function into actionable, client-centered advice. The challenge lies in ensuring that the advice provided is not only scientifically accurate, but also ethically sound, client-appropriate, and adheres to professional scope of practice, particularly when dealing with a client experiencing pain and seeking specific interventions. The RCEP must balance providing evidence-based guidance with respecting the client's autonomy and avoiding the provision of services outside their expertise. Correct approach analysis. The correct approach involves the RCEP utilizing their understanding of muscle physiology to explain the potential mechanisms behind the client's pain and how exercise interventions can address these. This includes discussing the roles of muscle fibers, sarcomeres, and the neuromuscular junction in force production and movement, and how these can be affected by injury or disuse. The RCEP then proposes a tailored exercise program that targets specific muscle groups and addresses the client's functional limitations, emphasizing proper technique and progression. This approach is best professional practice because it directly applies the RCEP core competencies, aligns with the ethical principle of beneficence, acting in the client's best interest, and respects the scope of practice by focusing on exercise prescription and rehabilitation rather than medical diagnosis or treatment. It empowers the client with knowledge and a clear path forward. Incorrect approaches analysis. One incorrect approach involves the RCEP immediately recommending a specific, advanced manual therapy technique without a thorough assessment or consideration of their scope of practice. This is a regulatory and ethical failure because it ventures into the domain of manual therapists or other allied health professionals, potentially providing interventions for which the RCEP is not credentialed or licensed. It violates the principle of non-maleficence if the technique is inappropriate or performed incorrectly, and it could lead to legal repercussions for practicing outside their scope. Another incorrect approach is for the RCEP to dismiss the client's pain as solely psychological and offer no exercise-based solutions. This is ethically problematic as it fails to acknowledge the client's subjective experience and neglects the RCEP responsibility to provide appropriate exercise interventions for physical conditions. It may also be a failure of beneficence by not offering potential avenues for relief and functional improvement through exercise. A third incorrect approach is for the RCEP to provide a generic, one-size-fits-all exercise program without considering the client's specific pain, functional limitations, or the underlying muscle physiology. This is a failure of professional practice because it does not demonstrate individualized care, which is a cornerstone of clinical exercise physiology. It risks exacerbating the client's condition or failing to address the root cause of their pain, thereby not acting in the client's best interest. Professional reasoning. When faced with a client experiencing pain and seeking exercise-based solutions, an RCEP should first conduct a comprehensive assessment to understand the nature of the pain, its location, duration, and any contributing factors. This assessment should inform their understanding of the underlying muscle structure and function that may be implicated. The RCEP should then leverage their knowledge of exercise physiology to explain the potential physiological mechanisms at play in a clear and understandable manner for the client. Based on this understanding and the assessment findings, they should develop and implement a safe, effective, and individualized exercise program. Throughout this process, the RCEP must remain within their scope of practice, referring to other healthcare professionals when necessary for diagnosis or interventions outside their expertise. Ethical considerations, such as informed consent, client autonomy, and the principles of beneficence and non-maleficence, should guide every decision. Question 8. Stakeholder feedback indicates a need to refine our understanding of how to best assess a patient experiencing dyspnea and palpitations during a submaximal exercise test, particularly concerning the interplay of the cardiovascular and respiratory systems. Given a patient reports significant shortness of breath and a racing heart, which of the following approaches best reflects a comprehensive impact assessment of their anatomical and physiological response to exercise? Option A. Analyzing the electrical activity of the heart (EC) in isolation, without considering the patient's breathing sensations or overall exertion level. Option B. Measuring only the patient's peak oxygen uptake during the test, assuming this single metric will capture the full physiological impact. Option C. Correlating the patient's reported dyspnea and palpitations with objective measures of heart rate variability, respiratory rate, and oxygen saturation, while also noting any observed changes in posture or breathing pattern. Option D, primarily focusing on the patient's subjective description of their symptoms and adjusting the exercise intensity based solely on their verbal feedback. The correct answer is C, correlating the patient's reported dyspnea and palpitations with objective measures of heart rate variability, respiratory rate, and oxygen saturation, while also noting any observed changes in posture or breathing pattern. Explanation: this scenario is professionally challenging because it requires the RCEP to balance the patient's subjective experience with objective physiological data, while adhering to professional scope of practice and ethical guidelines. The RCEP must interpret complex anatomical and physiological responses to exercise in a way that is both clinically sound and patient-centered. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that integrates multiple physiological systems. This aligns with the RCEP role in understanding the intricate interplay of the cardiovascular, respiratory, and musculoskeletal systems during exercise. By considering the patient's reported symptoms alongside objective measures like heart rate variability and respiratory rate, the RCEP can form a more accurate diagnosis and develop a safe and effective exercise prescription. This approach is consistent with the RCEP responsibility to provide individualized care based on a thorough understanding of human anatomy and physiology, as outlined in professional competency standards. An incorrect approach that focuses solely on subjective reporting without objective physiological data fails to meet the RCEP professional obligations. This could lead to misdiagnosis or an inappropriate exercise plan, potentially harming the patient. It neglects the scientific foundation of exercise physiology and the RCEP mandate to use objective measures. Another incorrect approach that relies exclusively on isolated physiological measures without considering the patient's reported symptoms overlooks the holistic nature of patient care. While objective data is crucial, it must be interpreted within the context of the individual's experience. Ignoring subjective feedback can lead to a disconnect between the assessment and the patient's actual needs and limitations, potentially resulting in an ineffective or even detrimental intervention. This approach fails to acknowledge the psychosomatic components that can influence physiological responses to exercise. A further incorrect approach that overemphasizes a single anatomical system without considering its interaction with others demonstrates a lack of comprehensive understanding. Exercise physiology is inherently systemic. The response of one system impacts others. Focusing narrowly can lead to incomplete assessments and interventions that do not address the full physiological picture, thereby failing to optimize patient outcomes and potentially missing critical compensatory mechanisms or maladaptive responses. The professional decision-making process for similar situations involves a systematic approach. 1. Actively listen to and validate the patient's subjective experience. 2. Select and administer appropriate objective physiological assessments relevant to the reported symptoms in the exercise context. 3. Critically analyze and integrate both subjective and objective data, looking for correlations and discrepancies. 4. Formulate a differential diagnosis or a working hypothesis regarding the underlying physiological mechanisms. 5. Develop an individualized, evidence-based exercise plan that addresses the identified physiological responses and patient goals while ensuring safety. 6. Continuously monitor and reassess the patient's response to exercise, making adjustments as needed. This process ensures that care is both scientifically rigorous and patient-centered, adhering to the highest professional and ethical standards. Question 9. Cost-benefit analysis shows that a client with moderate COP would significantly benefit from a specific type of home spirometer to monitor their respiratory function and adherence to prescribed exercises, but the recommended model is financially prohibitive for the client. What is the most appropriate course of action for the registered clinical exercise physiologist, RCEP? Option A. Proceed with recommending the most expensive, clinically validated spirometer and inform the client that they must find a way to afford it to receive services. Option B. Recommend a less expensive but clinically unvalidated, consumer-grade device that the client can afford, prioritizing immediate affordability over proven efficacy. Option C. Advise the client that without the specific recommended spirometer, effective monitoring and exercise adherence cannot be achieved. And and therefore, the exercise physiology services cannot proceed. Option D. Discuss alternative, more affordable spirometry devices that still meet clinical efficacy standards for monitoring. Explore potential community resources or financial assistance programs for the client, and collaboratively develop a phased approach to acquiring necessary equipment if immediate purchase is impossible. The correct answer is D. Discuss alternative, more affordable spirometry devices that still meet clinical efficacy standards for monitoring. Explore potential community resources or financial assistance programs for the client, and collaboratively develop a phased approach to acquiring necessary equipment if immediate purchase is impossible. Explanation: this scenario is professionally challenging because it requires the registered clinical exercise physiologist (RCEP) to balance the immediate financial implications for a client with the long-term health benefits and potential regulatory compliance issues. The RCEP must act as a patient advocate while adhering to professional standards and evidence-based practice. The client's financial constraints are a significant factor, but they cannot override the clinical necessity of appropriate respiratory management. The correct approach represents best professional practice because it prioritizes the client's health and safety, aligning with the RCEP ethical obligations and scope of practice as defined by relevant professional bodies and potentially state licensing boards, assuming a U.S. jurisdiction for RCEP. It involves a thorough assessment, clear communication of risks and benefits, and collaborative development of a plan that addresses both the client's financial limitations and their clinical needs. This approach ensures that the client receives appropriate care, even if it requires exploring alternative, more affordable options or phased implementation. An incorrect approach that focuses solely on the client's immediate financial inability to afford the recommended equipment, without exploring alternatives or advocating for the client's needs, would be professionally unacceptable. This could be seen as a failure to provide adequate care and could violate ethical principles of beneficence and non-maleficence. Another incorrect approach that dismisses the client's financial concerns and insists on the most expensive option without exploring alternatives would also be problematic, potentially leading to non-adherence and poorer health outcomes, and could be viewed as a lack of empathy and a failure to engage in shared decision-making. A third incorrect approach that involves recommending equipment outside the RCEP scope of practice, or without proper justification based on the client's specific respiratory condition, would be a direct violation of professional boundaries and could lead to harm. Professionals should use a decision-making framework that begins with a comprehensive assessment of the client's clinical needs, followed by an exploration of all available evidence-based interventions. This should include a discussion of the costs and benefits of each option, taking into account the client's financial situation. The RCEP should then collaborate with the client to develop a personalized plan, which may involve phased implementation, seeking financial assistance, or exploring lower-cost alternatives that still meet clinical requirements. Advocacy for the client with healthcare providers or insurance companies may also be a necessary step. Question 10. Quality control measures reveal that a long-term client who has consistently reported positive outcomes from their current exercise program has recently been diagnosed with a condition that presents a significant contraindication to one of the primary modalities they regularly engage in. The client is aware of the diagnosis, but expresses a strong desire to continue their current program, believing it is essential for their well-being, and is resistant to altering it. The clinical exercise physiologist has reviewed the latest research and clinical guidelines, which strongly advise against this specific modality given the new diagnosis. What is the most ethically and professionally appropriate course of action for the clinical exercise physiologist? Option A. Agree to continue the current exercise program as requested by the client, prioritizing client satisfaction and avoiding conflict, while making a note of the client's awareness of the risks. Option B. Engage in a thorough and empathetic discussion with the client, presenting the objective evidence and contraindications, exploring alternative safe and effective exercise options that align with their goals and new health status, and collaboratively developing a modified or alternative program, ensuring all discussions and decisions are meticulously documented. Option C. Immediately discontinue all services to the client, citing the contraindication and the client's refusal to comply to avoid any potential liability. Option D. Inform the client that their current program is no longer safe and that they must cease immediately, without further discussion or exploration of alternatives, as their health is paramount. The correct answer is B. Engage in a thorough and empathetic discussion with the client, presenting the objective evidence and contraindications, exploring alternative safe and effective exercise options that align with their goals and new health status, and collaboratively developing a modified or alternative program, ensuring all discussions and decisions are meticulously documented. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed wishes and the clinical exercise, physiologist's ethical and professional responsibility to ensure client safety and well-being. The client's desire to continue a specific exercise modality, despite evidence of potential harm and contraindications, necessitates a careful balancing act between respecting autonomy and upholding the duty of care. The RCEP must navigate this dilemma by prioritizing evidence-based practice and client safety while maintaining a therapeutic relationship. The correct approach prioritizes client safety and evidence-based practice, aligning with the core ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. It involves a thorough, empathetic, and educational discussion with the client, presenting objective evidence of risks, exploring alternative safe and effective exercise options, and documenting the process meticulously. This approach upholds the RCEP professional accountability and commitment to providing high-quality, safe care, as mandated by professional standards and ethical codes that emphasize informed consent and the physiologist's role in guiding clients toward optimal health outcomes. An incorrect approach that involves immediately discontinuing services without further discussion or exploration of alternatives fails to uphold the principle of respect for persons and autonomy. It may also violate the duty to educate and guide the client, potentially leading to a breakdown in the therapeutic relationship and the client seeking less qualified guidance elsewhere. Another incorrect approach, that of overriding the client's wishes without a comprehensive discussion and clear, documented rationale, can be perceived as paternalistic and may erode trust. It neglects the importance of shared decision-making, a cornerstone of ethical practice. Finally, an approach that involves simply agreeing to the client's potentially harmful request, perhaps due to a desire to avoid conflict or maintain revenue, represents a severe breach of professional duty and ethical responsibility, directly contravening the principles of beneficence and non-maleficence, and potentially leading to significant harm to the client. Professionals should employ a decision-making framework that begins with identifying the ethical conflict. This is followed by gathering all relevant information, including objective data, client history, and professional guidelines. Next, they should identify stakeholders and their perspectives. Then, potential courses of action are brainstormed, and each is evaluated against ethical principles, professional standards, and legal requirements. The chosen course of action should be implemented, and its outcomes monitored and reviewed. In this case, the RCEP must engage in open communication, present evidence, explore alternatives, and document all interactions and decisions. Question 11. The risk matrix shows a moderate likelihood of an adverse event if a client with type 2 diabetes, currently managing their condition with diet and exercise, engages in a high-intensity interval training (HIIT) program without prior acclimatization, as requested by the client who is eager to rapidly improve their fitness. As a registered clinical exercise physiologist, RCEP, what is the most ethically and professionally sound course of action? Option A. Immediately implement the client's requested HIIT program, trusting their judgment and desire for rapid progress to foster client satisfaction and adherence. Option B. Refuse to implement the HIIT program altogether, citing the risks, and insist the client adhere to their current, less intense exercise regimen without further discussion. Option C. Proceed with the HIIT program as requested, but advise the client to monitor their blood glucose levels more frequently without making any modifications to the program itself. Option D. Discuss the client's motivations for wanting to start HIIT immediately. Explain the potential risks associated with rapid progression and their specific diabetes management, and collaboratively develop a modified, gradual introduction to HIIT or alternative exercise strategies that align with their goals and ensure safety. Correct answer is D. Discuss the client's motivations for wanting to start HIIT immediately. Explain the potential risks associated with rapid progression and their specific diabetes management, and collaboratively develop a modified, gradual introduction to HIIT or alternative exercise strategies that align with their goals and ensure safety. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed desire and the RCEP professional judgment regarding their safety and well-being, particularly in the context of managing diabetes mellitus. The RCEP must navigate the ethical imperative to respect client autonomy while upholding their responsibility to provide safe and evidence-based care. Adhering to the RCEP scope of practice and professional guidelines, the complexity arises from the potential for the client's request to exacerbate their condition or lead to adverse health outcomes, necessitating a careful balance of support, education, and boundary setting. The correct approach represents best professional practice by prioritizing a collaborative and educational strategy. This involves open communication to understand the client's motivations and concerns, followed by providing clear, evidence-based information about the risks and benefits of their proposed activity in relation to their diabetes management. The RCEP then offers alternative, safer strategies that align with the client's goals while mitigating risks. This approach respects client autonomy by empowering them with knowledge to make informed decisions, upholds the RCEP ethical duty of beneficence and non-maleficence by ensuring safety, and adheres to professional standards of care for individuals with diabetes. An incorrect approach that involves immediately acceding to the client's request without thorough assessment or education fails to uphold the RCEP duty of care. This could lead to harm, violating the principle of non-maleficence and potentially breaching professional standards for managing clients with chronic conditions like diabetes. Another incorrect approach, which is to dismiss the client's request outright without attempting to understand their perspective or offering alternatives, undermines client autonomy and the therapeutic relationship. This can lead to disengagement from care and a failure to achieve optimal health outcomes. A third incorrect approach, focusing solely on the client's stated desire without considering the broader implications for their diabetes management and overall health, demonstrates a lack of comprehensive clinical judgment and adherence to evidence-based practice. Professionals should employ a decision-making framework that begins with active listening and empathy to understand the client's perspective. This is followed by a thorough risk-benefit analysis, considering the client's specific health status, including their diabetes management. The RCEP then uses their expertise to educate the client on potential risks and benefits, explore alternative strategies, and collaboratively develop a safe and effective plan. This process ensures that client autonomy is respected within the boundaries of safe and ethical practice. Question 12. Compliance review shows that a registered clinical exercise physiologist, RCEP, is working with a patient who has multiple chronic conditions and expresses a desire for a comprehensive wellness plan that includes not only exercise, but also detailed nutritional guidance and stress management techniques beyond basic relaxation advice. The RCEP scope of practice clearly defines their role in designing and implementing exercise programs for individuals with chronic diseases. Which of the following represents the most appropriate professional response for the RCEP in this situation? Option A. The RCEP should attempt to create a generalized nutritional plan and offer basic stress reduction techniques, as these are often components of overall wellness, and then focus primarily on the exercise prescription. Option B. The RCEP should develop an exercise program tailored to the patient's conditions and then refer the patient to a registered dietitian for nutritional guidance and a licensed mental health professional for stress management, clearly communicating the patient's exercise needs to these specialists. Option C. The RCEP should inform the patient that their role is strictly limited to exercise and that they cannot address any other aspect of wellness, discouraging further discussion on these topics. Option D. The RCEP should research and implement a broad range of nutritional and stress management strategies themselves, assuming that a holistic approach is always best regardless of specific qualifications. The correct answer is B. The RCEP should develop an exercise program tailored to the patient's conditions and then refer the patient to a registered dietitian for nutritional guidance and a licensed mental health professional for stress management, clearly communicating the patient's exercise needs to these specialists. Explanation. This scenario presents a professional challenge because it requires the registered clinical exercise physiologist, RCEP, to navigate the boundaries of their defined scope of practice while responding to a patient's expressed needs. The RCEP must balance the imperative to provide safe and effective care within their expertise against the patient's desire for a broader range of services. Careful judgment is required to ensure that the RCEP does not overstep their qualifications, thereby compromising patient safety and violating professional standards. The correct approach represents best professional practice because it adheres strictly to the definition and scope of clinical exercise physiology as established by relevant regulatory bodies and professional organizations. This approach prioritizes patient safety by ensuring that interventions are evidence-based and delivered by qualified professionals. It also upholds ethical obligations by maintaining professional boundaries and advocating for the patient's needs through appropriate referral when necessary. This aligns with the RCEP responsibility to practice within their defined competencies and to facilitate access to care that may lie outside their direct purview. An incorrect approach that involves the RCEP attempting to provide services outside their defined scope of practice, such as prescribing specific dietary supplements or offering psychological counseling without appropriate licensure or certification, represents a significant regulatory and ethical failure. This could lead to patient harm due to lack of expertise, misdiagnosis, or inappropriate treatment. It violates the principle of practicing within one's competence and could result in disciplinary action from certifying bodies and potential legal liability. Another incorrect approach, such as dismissing the patient's concerns outright without exploring their underlying needs or potential contributing factors, fails to uphold the ethical standard of patient-centered care. While the RCEP may not be able to directly address all of the patient's expressed desires, a failure to explore the root cause of these desires or to offer appropriate guidance and referral demonstrates a lack of professional diligence and empathy. This can erode patient trust and hinder the therapeutic relationship. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's request against the RCEP scope of practice, established clinical guidelines, and ethical principles. This includes active listening to understand the patient's underlying needs, assessing the safety and efficacy of any proposed intervention within the RCEP expertise, and identifying when referral to another healthcare professional is necessary. Documentation of the assessment, decision-making process, and any referrals made is also crucial. Question 13. Assessment of a client's knee joint pain and limited range of motion following a past tibial plateau fracture, focusing on identifying exercise-related interventions. The client reports intermittent pain with squatting and climbing stairs and a subjective feeling of instability. The RCEP has access to the client's previous medical imaging reports and physician's discharge summary. Option A. Refer the client immediately to a physician for a new diagnostic workup of the knee pain, as the fracture history suggests potential ongoing pathology requiring medical evaluation. Option B. Conduct a functional movement screen and assess active and passive range of motion, muscle strength of the quadriceps, hamstrings and gluteal muscles, and proprioceptive control. Then design an exercise program to address identified deficits while monitoring pain response. Option C. Rely exclusively on the client's subjective report of pain and instability to guide exercise modifications, without performing objective biomechanical assessments. Option D. Focus solely on prescribing progressive resistance exercises for the lower body, assuming the pain is a normal consequence of the previous injury and will resolve with increased strength. The correct answer is B. Conduct a functional movement screen and assess active and passive range of motion, muscle strength of the quadriceps, hamstrings and gluteal muscles, and proprioceptive control. Then design an exercise program to address identified deficits while monitoring pain response. Explanation. Scenario analysis. This scenario presents a professional challenge for a registered clinical exercise physiologist, RCEP, in assessing a client with a history of a specific skeletal injury and subsequent joint dysfunction. The challenge lies in accurately interpreting the client's subjective reports of pain and functional limitations in the context of objective biomechanical assessments, while adhering strictly to the RCEP scope of practice and regulatory guidelines. The RCEP must differentiate between their role in exercise prescription and rehabilitation and the roles of other healthcare professionals, such as physicians or physical therapists, particularly concerning diagnosis and medical management. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates the client's reported symptoms with objective biomechanical evaluations of joint mechanics. This approach aligns with the RCEP responsibility to design and implement safe and effective exercise programs tailored to the individual's condition. By focusing on functional movement patterns, range of motion, muscle strength, and proprioception, the RCEP can identify specific deficits that contribute to the client's joint dysfunction and pain. This data then informs the development of an exercise prescription that aims to improve joint stability, reduce compensatory movements, and enhance overall function, all within the RCEP-defined scope of practice. This adheres to the principle of evidence-based practice and client-centered care, ensuring interventions are appropriate and beneficial. Incorrect approach is analysis, an approach that solely relies on the client's subjective report of pain without objective biomechanical assessment would be professionally deficient. This fails to provide a complete picture of the underlying biomechanical issues and could lead to an ineffective or even detrimental exercise program. It also risks overstepping the RCEP role by potentially interpreting or diagnosing the cause of pain without appropriate medical or physical therapy input. Another incorrect approach would be to immediately refer the client to a physician for a new diagnosis without first conducting a thorough RCEP-led biomechanical assessment. A referral is sometimes necessary, and RCEP expertise lies in assessing functional limitations and designing exercise interventions. Skipping this assessment stage means potentially missing opportunities to address exercise-related factors contributing to the client's condition and failing to utilize the RCEP core competencies. An approach that focuses exclusively on strength training without considering the client's reported pain, joint mechanics, or range of motion limitations would be inappropriate. This could exacerbate existing issues, lead to further injury, and disregard the client's subjective experience and the biomechanical context of their condition. It fails to acknowledge the interconnectedness of strength, flexibility, and joint health. Professional reasoning. When faced with a client presenting with skeletal and joint issues, the RCEP should employ a systematic decision-making process. This begins with a thorough client history and subjective assessment of symptoms. Following this, an objective biomechanical assessment should be conducted, focusing on range of motion, flexibility, strength, posture, and functional movement patterns relevant to the affected joints. Based on this comprehensive evaluation, the RCEP can then determine if the client's needs fall within their scope of practice for exercise prescription and rehabilitation. If the assessment reveals signs or symptoms suggestive of a condition requiring medical diagnosis or intervention beyond the RCEP scope, or if the client's condition is unstable or worsening, an appropriate referral to a physician or physical therapist should be made. The RCEP role is to optimize exercise for health and performance, addressing functional limitations through exercise, not to diagnose or medically manage conditions. Question 14. Comparative studies suggest that individuals with chronic conditions may report functional limitations in flexibility and balance that do not always align with objective assessment findings. A registered clinical exercise physiologist, RCEP, is assessing a client who reports significant difficulty with everyday tasks due to poor balance and stiffness, yet performs within expected ranges on several standardized balance and flexibility tests. Which of the following approaches best reflects the RCEP professional responsibility in this situation? Option A. Rely solely on the objective assessment results, assuming the client's perception is inaccurate, and proceed with an exercise program based strictly on the measured performance. Option B. Select a single, widely recognized balance assessment tool and use its results as the primary determinant for the exercise program, disregarding other subjective or objective data that may conflict. Option C. Prioritize the client's subjective report of limitations and design an exercise program that addresses their perceived deficits, even if objective measures do not fully support the extent of these limitations. Option D. Conduct a more comprehensive battery of flexibility and balance assessments, including functional movement screens and task-specific evaluations, and then collaboratively discuss the objective findings with the client, exploring potential reasons for the perceived discrepancy and tailoring the exercise program accordingly. The correct answer is D. Conduct a more comprehensive battery of flexibility and balance assessments, including functional movement screens and task-specific evaluations, and then collaboratively discuss the objective findings with the client, exploring potential reasons for the perceived discrepancy and tailoring the exercise program accordingly. Explanation. Scenario analysis. This scenario presents a common challenge for registered clinical exercise physiologists, RCEP, where a client exhibits a significant discrepancy between their self-reported functional limitation and objective assessment findings regarding flexibility and balance. The professional challenge lies in reconciling subjective client experience with objective data, ensuring the assessment is both accurate and ethically sound, and that the subsequent exercise prescription is safe and effective. This requires careful judgment to avoid over- or undertreating the client's condition. Correct approach analysis. The correct approach involves a comprehensive, multifaceted assessment that integrates objective measures with subjective client feedback. This aligns with the RCEP scope of practice, which emphasizes evidence-based practice and client-centered care. By utilizing a battery of standardized flexibility and balance tests, e.g., timed up and go, Borg balance scale, sit and reach test, and systematically documenting the results, the RCEP establishes a baseline and identifies specific deficits. Crucially, this objective data is then discussed with the client, allowing for exploration of the discrepancy. This collaborative approach ensures the client feels heard and understood, fostering adherence to the exercise program. Regulatory frameworks for RCEP emphasize the importance of accurate assessment and individualized programming, which this approach directly supports. Ethical considerations also mandate that the RCEP acts in the best interest of the client, which includes validating their experience while ensuring interventions are based on sound physiological principles and objective evidence. Incorrect approaches analysis. One incorrect approach involves solely relying on the client's subjective report of limitations without conducting thorough objective assessments. This fails to meet the RCEP professional responsibility to provide evidence-based care and could lead to an inappropriate exercise prescription that is either insufficient to address actual deficits or unnecessarily restrictive, potentially hindering functional improvement. Ethically, this approach could be seen as a failure to act with due diligence and competence. Another incorrect approach is to dismiss the client's subjective experience entirely and focus solely on objective findings, even when there's a significant disconnect. This can alienate the client, erode trust, and lead to poor adherence. It also fails to acknowledge the psychological and perceptual components that can influence functional capacity and quality of life. Regulatory guidelines for RCEP stress the importance of a holistic client assessment, which includes understanding their lived experience. A third incorrect approach is to select only a single flexibility or balance assessment tool without considering the client's specific condition or the limitations of that single tool. This can lead to an incomplete picture of the client's functional status. Best professional practice dictates the use of multiple, appropriate assessment tools to gain a comprehensive understanding, as mandated by the principles of thorough and accurate evaluation inherent in RCEP certification standards. Professional reasoning. When faced with a discrepancy between subjective reports and objective findings, the RCEP should employ a systematic decision-making process. This involves 1. Confirming the accuracy and appropriateness of the objective assessment tools used. 2. Reevaluating the client's subjective report for any potential misunderstandings or contributing factors, e.g., fear of falling, pain perception. 3. Engaging in open and empathetic communication with the client to explore the reasons for the discrepancy. 4. Integrating all gathered information to formulate a safe, effective, and client-centered exercise plan. This process ensures that interventions are grounded in evidence, tailored to the individual, and ethically sound. Question 15. Compliance review shows that a registered clinical exercise physiologist, RCEP, is working with a client who has a history of hypertension and is undergoing a graded exercise test. During the test, the client reports a sudden onset of significant shortness of breath dyspnea at a moderate exercise intensity, which is more severe than they have experienced previously. Their heart rate is elevated but within expected limits for the intensity, and their blood pressure is also elevated but not exceeding pre-established safety cutoffs. The RCEP observes that the client appears visibly distressed and is breathing rapidly. What is the most appropriate immediate course of action for the RCEP? Option A. Immediately terminate the exercise test and refer the client to their physician for further medical evaluation due to the new and severe onset of dyspnea. Option B. Instruct the client to take deep, slow breaths and attempt to lower their perceived exertion, assuming it is a temporary response to anxiety. Option C. Document the shortness of breath as a sign of deconditioning and continue the exercise test at a lower intensity, planning to gradually increase it as the client adapts. Option D. Advise the client to push through the discomfort, as shortness of breath can be a normal physiological response to increased exercise intensity, and continue the test. The correct answer is A. Immediately terminate the exercise test and refer the client to their physician for further medical evaluation due to the new and severe onset of dyspnea. Explanation. Scenario analysis. This scenario presents a challenge because the RCEP must interpret and apply physiological data within the context of a client's specific medical history and current presentation. The risk lies in misinterpreting subtle physiological changes, attributing them to the wrong cause, or failing to recognize a potentially serious underlying condition. This requires a nuanced understanding of exercise physiology, differential diagnosis, and the scope of practice for an RCEP. Correct approach analysis. The correct approach involves a systematic evaluation of the client's reported symptoms in conjunction with objective physiological measurements, recognizing that exertional dyspnea can have multiple etiologies, including cardiac, pulmonary, or even deconditioning. The RCEP must prioritize ruling out serious conditions. Referring the client for further medical evaluation when symptoms are new, severe, or unexplained is the most responsible and ethically sound action. This aligns with the RCEP role as a healthcare professional who works collaboratively with physicians and other medical providers, ensuring client safety and appropriate care pathways. It upholds the principle of do no harm by not attempting to manage potentially serious conditions beyond the RCEP scope of practice. Incorrect approaches analysis. One incorrect approach would be to dismiss the dyspnea as simply a sign of poor cardiovascular fitness and continue with the prescribed exercise program without further investigation. This fails to acknowledge the potential for underlying pathology and could lead to significant harm if the dyspnea is indicative of a serious medical issue. This approach violates the ethical obligation to prioritize client safety and could be considered negligent. Another incorrect approach would be to immediately discontinue all exercise and advise the client to rest indefinitely. Caution is warranted. A complete cessation of exercise without a medical diagnosis may not be in the client's best long-term interest and could lead to deconditioning. This oversimplifies the situation and bypasses the necessary diagnostic steps. A third incorrect approach would be to attempt to self-diagnose the cause of the dyspnea and prescribe specific interventions based on that assumption. This exceeds the RCEP scope of practice, which is to design and implement exercise programs, not to diagnose or treat medical conditions. This action constitutes practicing medicine without a license and poses a significant risk to the client. Professional reasoning. When faced with new or concerning symptoms during an exercise session, the RCEP should follow a structured decision-making process. 1. Assess the client's subjective report of symptoms and their severity. 2. Correlate subjective symptoms with objective physiological data, heart rate, blood pressure, oxygen saturation, perceived exertion. 3. Consider potential differential diagnoses based on the client's medical history and the observed presentation. 4. Determine if the symptoms are within the expected physiological response to exercise for that individual. 5. If symptoms are new, severe, unexplained, or concerning for underlying pathology, the priority is to refer the client to a qualified medical professional for further evaluation and diagnosis. 6. Collaborate with the medical team to understand the diagnosis and any exercise contraindications or modifications. 7. Adjust the exercise program based on medical recommendations and the client's ongoing response. Question 16. To address the challenge of designing and implementing a safe and effective exercise program for a client diagnosed with a progressive form of muscular dystrophy, what is the most appropriate initial step for a registered clinical exercise physiologist (RCEP) to take, ensuring adherence to best practices and regulatory guidelines? Option A. Immediately initiate a standardized, moderate-intensity aerobic and resistance training program based on general guidelines for individuals with chronic conditions, assuming the client can tolerate a typical exercise load. Option B. Delegate the primary responsibility for exercise prescription to the client's physical therapist, providing only general support and encouragement without direct program design. Option C. Focus solely on improving the client's cardiovascular fitness through high-intensity interval training, as this is often beneficial for overall health in individuals with chronic diseases. Option D. Conduct a comprehensive baseline assessment of the client's functional capacity, including cardiovascular endurance, muscular strength and endurance, flexibility and balance, while also gathering detailed medical history and current symptomology, and consulting with the client's physician regarding exercise recommendations and contraindications. The correct answer is D. Conduct a comprehensive baseline assessment of the client's functional capacity, including cardiovascular endurance, muscular strength and endurance, flexibility and balance, while also gathering detailed medical history and current symptomology, and consulting with the client's physician regarding exercise recommendations and contraindications. Explanation: the scenario presents a professional challenge due to the inherent variability and progressive nature of muscular dystrophy, requiring a registered clinical exercise physiologist, RCEP, to navigate complex client needs within established professional and regulatory boundaries. The RCEP must balance the client's desire for independence and functional improvement with the physiological limitations imposed by the condition, ensuring safety and efficacy of the exercise program. This requires a thorough understanding of the client's specific diagnosis, stage of disease, and potential comorbidities, all while adhering to the RCEP scope of practice and ethical guidelines. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized, and evidence-based strategy. This involves a detailed initial assessment to establish baseline function, identify specific limitations and goals, and screen for contraindications. Ongoing monitoring and program modification are crucial due to the progressive nature of muscular dystrophy, ensuring the exercise program remains safe and effective as the client's condition evolves. Collaboration with the client's healthcare team, including physicians and physical therapists, is paramount for integrated care and to ensure the exercise plan complements other therapeutic interventions. This approach aligns with RCEP certification standards that emphasize client-centered care, interdisciplinary collaboration, and the application of exercise science principles to manage chronic conditions. An incorrect approach that involves implementing a standardized, high-intensity exercise program without thorough assessment or consideration of the client's specific muscular dystrophy subtype and disease progression would be a significant regulatory and ethical failure. This could lead to overexertion, injury, or exacerbation of symptoms, violating the RCEP duty of care and potentially contravening guidelines related to safe exercise prescription for individuals with neuromuscular disorders. Another incorrect approach, such as solely relying on the client's self-reported tolerance without objective assessment or physician consultation, would fail to meet the professional standard of care. This neglects the RCEP responsibility to provide expert guidance and oversight, potentially leading to inappropriate exercise prescription and adverse outcomes, which could be viewed as a breach of professional competence and ethical conduct. A third incorrect approach, focusing exclusively on strength training without addressing potential cardiovascular or respiratory limitations, would be an incomplete and potentially unsafe strategy, failing to provide comprehensive care as expected of an RCEP. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly understand the client's diagnosis and its implications for exercise. 2. Conduct a comprehensive initial assessment, including functional capacity, medical history, and client goals. 3. Develop an individualized, progressive exercise plan that prioritizes safety and efficacy, considering potential risks and benefits. 4. Establish clear communication channels with the client and their healthcare providers. 5. Implement ongoing monitoring and be prepared to modify the program based on client response and disease progression. 6. Adhere strictly to the RCEP scope of practice and ethical guidelines. Question 17. The audit findings indicate a discrepancy between a client's recent graded exercise test, GXT, results and their current exercise prescription. The GXT data suggests a lower functional capacity than what is currently being prescribed. Which of the following actions best reflects the RCEP professional responsibility in this situation? Option A. Modify the exercise prescription based on the client's subjective report of their perceived exertion during previous exercise sessions, without re-evaluating the GXT data. Option B. Recommend the client undergo a new GXT before any adjustments are made to their current prescription, and maintain the current prescription until then. Option C. Immediately adjust the exercise prescription downwards to align with the lower functional capacity indicated by the GXT results, and document the rationale for the change. Option D. Continue with the current exercise prescription, assuming the client has improved since the GXD, and advise them to report any discomfort. The correct answer is C. Immediately adjust the exercise prescription downwards to align with the lower functional capacity indicated by the GXD results, and document the rationale for the change. Explanation. The audit findings highlight a common challenge in clinical exercise physiology, ensuring that exercise testing protocols and subsequent prescription accurately reflect an individual's current health status and functional capacity, while adhering to established professional standards and regulatory guidelines. This scenario is professionally challenging because it requires the RCEP to critically evaluate existing documentation, identify potential discrepancies, and implement corrective actions that prioritize client safety and efficacy of care, all within the scope of their professional responsibilities and the governing regulatory framework. The need for careful judgment arises from the potential for misinterpretation of data, the risk of over- or underprescribing exercise, and the ethical imperative to maintain accurate and complete client records. The correct approach represents best professional practice because it involves a systematic and evidence-based review of the client's exercise testing results and prescription. This approach prioritizes client safety by ensuring that the prescribed exercise intensity, duration, and frequency are appropriate for the individual's physiological response and clinical condition, as evidenced by the testing data. It also upholds professional integrity by demonstrating a commitment to accurate record-keeping and adherence to established protocols for exercise assessment and prescription. This aligns with the core principles of clinical exercise physiology, which emphasize individualized care and the application of scientific principles to promote health and well-being. An incorrect approach that relies solely on the client's subjective report of their previous exercise tolerance without re-evaluating the objective testing data is professionally unacceptable. This failure constitutes a disregard for the established RCEP scope of practice, which mandates the use of objective data for exercise prescription. It also presents a significant ethical failure by potentially compromising client safety through an inaccurate assessment of their current capabilities, leading to an inappropriate exercise prescription. Furthermore, it violates the principle of evidence-based practice by neglecting crucial objective information. Another incorrect approach that involves making assumptions about the client's progress based on general population norms, rather than the specific results of their recent exercise testing, is also professionally unacceptable. This demonstrates a lack of individualized care and a failure to adhere to the specific requirements of exercise testing and prescription for a clinical population. It represents a regulatory and ethical failure by not basing the prescription on the unique physiological data obtained, thereby increasing the risk of adverse events or suboptimal outcomes. The professional decision-making process for similar situations should involve a structured approach. 1. Thoroughly review all available objective data from the exercise test. 2. Compare the objective data with the current exercise prescription and the client's reported subjective experiences. 3. Identify any discrepancies or potential risks based on the comparison. 4. Consult relevant professional guidelines and regulatory standards for best practices in exercise testing and prescription. 5. If discrepancies are identified, initiate a re-evaluation of the exercise prescription, potentially involving further testing or consultation with other healthcare professionals. 6. Document all findings, decisions, and actions taken in the client's record. 7. Prioritize client safety and well-being in all decision-making. Question 18. Benchmark analysis indicates that a registered clinical exercise physiologist RCEP is working with a 65-year-old client diagnosed with type 2 diabetes mellitus, stage 2 hypertension, and osteoarthritis of the knees. The client reports moderate knee pain during ambulation and has a recent HbA1c of 7.8%. The RCEP needs to design an exercise program. Which of the following approaches best aligns with the RCEP scope of practice and ethical responsibilities in managing this complex client profile? Option A. Advise the client to cease all strenuous physical activity until their HbA1c and blood pressure are within optimal ranges, and to focus solely on dietary modifications. Option B. Develop a comprehensive exercise program that incorporates low-impact aerobic activities, progressive resistance training targeting major muscle groups, and flexibility exercises, with specific modifications for knee osteoarthritis and careful monitoring of blood glucose and blood pressure responses to exercise, while consulting with the client's physician regarding any exercise-induced symptoms. Option C. Recommend a daily walking program of 60 minutes at a moderate intensity, without specific consideration for the client's knee pain or blood pressure fluctuations during exercise. Option D. Focus primarily on high-intensity interval training to improve cardiovascular health and insulin sensitivity, assuming the client's comorbidities will be managed by their primary care physician. The correct answer is B. Develop a comprehensive exercise program that incorporates low-impact aerobic activities, progressive resistance training targeting major muscle groups, and flexibility exercises, with specific modifications for knee osteoarthritis and careful monitoring of blood glucose and blood pressure responses to exercise, while consulting with the client's physician regarding any exercise-induced symptoms. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the RCEP to integrate complex pathophysiological knowledge of chronic diseases with the practical application of exercise programming for a client presenting with multiple comorbidities. The challenge lies in accurately assessing the interplay of these conditions and their impact on exercise response, ensuring safety, and optimizing therapeutic outcomes within the RCEP scope of practice. The RCEP must navigate potential contraindications and synergistic effects of the client's conditions. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment that directly addresses the client's specific pathophysiological profile. This involves understanding how the underlying mechanisms of diabetes, hypertension, and osteoarthritis interact and influence exercise tolerance and risk. By considering these interactions, the RCEP can develop a tailored exercise prescription that is safe, effective, and aligned with the client's functional capacity and treatment goals, adhering to the RCEP professional standards and ethical obligations to provide competent care. Incorrect approaches analysis. One incorrect approach would be to focus solely on one condition, such as diabetes, and develop an exercise plan without adequately considering the implications of hypertension and osteoarthritis. This is a regulatory and ethical failure because it demonstrates a lack of comprehensive patient assessment and a failure to consider the holistic impact of multiple chronic diseases on exercise response. It could lead to an unsafe or ineffective program, potentially exacerbating other conditions or leading to adverse events, violating the RCEP duty of care. Another incorrect approach would be to implement a generic, high-intensity exercise program without a thorough assessment of the client's current functional status and the specific pathophysiological limitations imposed by their conditions. This approach fails to acknowledge the individual nature of chronic disease management and the need for personalized interventions. Ethically, it represents a departure from best practices in clinical exercise physiology, potentially leading to injury or discouraging the client due to an inappropriate exercise load, thereby failing to uphold professional competence and client well-being. A third incorrect approach would be to recommend over-the-counter supplements or unproven therapies to manage the client's conditions alongside exercise, without consulting with their physician or adhering to evidence-based guidelines. This constitutes a significant regulatory and ethical breach, as it extends beyond the RCEP scope of practice and could interfere with prescribed medical treatments. It also risks promoting potentially harmful or ineffective intervention, undermining the client's trust and the integrity of evidence-based clinical practice. Professional reasoning. Professionals should approach such scenarios by first conducting a thorough patient history and physical assessment, specifically probing for the impact of each chronic condition on their daily function and exercise tolerance. This should be followed by a review of relevant medical records and consultation with the client's physician to gain a comprehensive understanding of their current medical management and any specific contraindications or precautions. The RCEP should then utilize their knowledge of exercise physiology and the pathophysiology of chronic diseases to synthesize this information, identifying potential risks and benefits of various exercise modalities. The exercise prescription should be developed collaboratively with the client, setting realistic goals and incorporating regular monitoring and reassessment to ensure safety and efficacy, always operating within the defined scope of practice for a registered clinical exercise physiologist. Question 19. The control framework reveals that a registered clinical exercise physiologist (RCEP) has received a referral for a patient with a complex cardiac condition. The physician's referral includes a general exercise prescription, but the RCEP identifies several specific parameters within the prescription that appear to deviate from current evidence-based guidelines for this particular cardiac diagnosis and the patient's reported functional limitations. What is the most appropriate course of action for the RCEP? Option A. Consult directly with the referring physician to clarify the exercise prescription and discuss potential modifications based on current evidence-based guidelines and the patient's specific needs. Option B. Independently modify the exercise prescription to align with current evidence-based guidelines, believing this is in the patient's best interest, and document the changes made. Option C. Proceed with the exercise prescription as written, assuming the physician has a specific rationale not immediately apparent, and monitor the patient closely for any adverse reactions. Option D. Decline to provide services, citing the discrepancy in the exercise prescription as a reason for not being able to safely and effectively manage the patient. Correct answer is A. Consult directly with the referring physician to clarify the exercise prescription and discuss potential modifications based on current evidence-based guidelines and the patient's specific needs. Explanation. This scenario presents a professional challenge due to the inherent responsibility of a registered clinical exercise physiologist (RCEP) to operate within the established scope of practice and adhere to regulatory guidelines. The RCEP must exercise careful judgment to ensure that their interventions are evidence-based, safe, and aligned with the patient's diagnosed condition and physician's orders, while also respecting the boundaries of their professional expertise. The correct approach represents best professional practice because it prioritizes patient safety and adherence to the established regulatory framework for RCEP. By consulting with the referring physician and seeking clarification on the exercise prescription, the RCEP demonstrates a commitment to understanding the patient's specific needs and limitations, ensuring that the exercise program is appropriate and effective. This aligns with the RCEP ethical obligation to provide competent care and to practice within their scope, as mandated by professional standards and potentially by state licensure laws governing allied health professionals, which often require collaboration with physicians for certain patient populations or conditions. An incorrect approach that involves independently modifying the exercise prescription without physician consultation represents a significant regulatory and ethical failure. This could be construed as practicing outside the scope of practice, potentially leading to patient harm if the modifications are inappropriate for the underlying medical condition. It also undermines the collaborative nature of patient care, which is a cornerstone of clinical practice and often a requirement for reimbursement and professional accountability. Furthermore, failing to document the consultation and the rationale for any changes would be a breach of record-keeping standards, which are critical for legal and ethical compliance. Another incorrect approach, such as proceeding with the original prescription without addressing the perceived discrepancy, demonstrates a lack of critical thinking and a failure to uphold the duty of care. This could lead to ineffective or even harmful exercise interventions, violating the RCEP responsibility to provide evidence-based and individualized care. It also ignores the potential for misinterpretation or incomplete information, which could have serious consequences for the patient's health and recovery. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly review the patient's medical history, physician's referral, and any existing exercise prescription. Second, identify any discrepancies, ambiguities, or concerns regarding the appropriateness of the prescribed exercise. Third, prioritize patient safety and seek clarification from the referring physician or appropriate healthcare provider. Fourth, document all communications, decisions, and rationale thoroughly. Finally, proceed with the exercise intervention only after ensuring clarity and appropriateness, and continue to monitor the patient's response and adjust as needed in consultation with the medical team. Question 20. Consider a scenario where a client presents with a goal of improving their ability to sustain prolonged, low-intensity activities, such as long-distance walking, while also expressing a desire to increase their overall muscular endurance for daily tasks. The registered clinical exercise physiologist, RCEP, is tasked with designing an appropriate exercise program. Which of the following approaches best reflects an understanding of muscle fiber type contributions to these goals and aligns with best professional practice for an RCEP? Option A. Recommend a program that solely focuses on increasing maximal strength through very heavy lifting with minimal repetitions, assuming this will indirectly improve all aspects of muscular function. Option B. Design a program that emphasizes aesthetic muscle hypertrophy with moderate weights and moderate repetitions, without specific consideration for the client's endurance goals or the underlying muscle fiber types involved. Option C. Prioritize the development of slow-twitch, type I muscle fibers through a program emphasizing moderate intensity, longer duration aerobic activities, and moderate resistance training with higher repetitions. Option D. Focus on developing fast-twitch, type IX muscle fibers through high-intensity interval training and heavy, low-repetition resistance exercises. The correct answer is C. Prioritize the development of slow-twitch, type I muscle fibers through a program emphasizing moderate intensity, longer duration aerobic activities, and moderate resistance training with higher repetitions. Explanation. This scenario presents a professional challenge because a registered clinical exercise physiologist, RCEP, must accurately assess an individual's physiological response to exercise for effective program design and to ensure safety. Misinterpreting the contribution of different muscle fiber types can lead to suboptimal training, potential overtraining, or failure to achieve desired outcomes, impacting client progress and potentially their health. The RCEP responsibility extends beyond simply prescribing exercise. It involves understanding the underlying physiological mechanism to tailor interventions precisely. The correct approach represents best professional practice because it directly aligns with the RCEP scope of practice, which includes the assessment and management of individuals with or at risk for chronic diseases and health conditions through exercise. Understanding muscle fiber types, type I, type E, type X, and their relative contributions to different exercise intensities and durations is fundamental to designing exercise programs that effectively target specific physiological adaptations. For instance, differentiating between endurance-focused type I fibers and power-focused type Roman II fibers allows for the appropriate selection of exercise modalities, intensities, and volumes to meet a client's goals, whether they are improving cardiovascular health, increasing muscular strength, or enhancing athletic performance. This approach is ethically sound as it prioritizes client well-being and efficacy of intervention, adhering to professional standards of care. An incorrect approach that focuses solely on perceived exertion without considering the underlying muscle fiber recruitment patterns would be professionally unacceptable. This fails to leverage the RCEP specialized knowledge and could lead to an exercise prescription that is either too demanding or not demanding enough for the client's specific physiological profile and goals. Ethically, this represents a failure to provide a scientifically informed and individualized exercise prescription, potentially hindering client progress and not meeting the standard of care expected of an RCEP. Another incorrect approach, such as recommending a generic, one-size-fits-all training program regardless of the client's specific muscle fiber characteristics or exercise goals, is also professionally deficient. This demonstrates a lack of individualized assessment and program design, which is a cornerstone of clinical exercise physiology. It disregards the nuanced physiological differences that influence exercise response and adaptation, leading to potentially ineffective or even detrimental training outcomes. This approach violates the ethical principle of beneficence by not maximizing the potential benefits of exercise for the individual. A further incorrect approach, such as prioritizing aesthetic outcomes over physiological function when designing an exercise program, would be inappropriate for an RCEP. While aesthetics can be a client goal, the RCEP primary responsibility is to optimize physiological health and function, especially in clinical populations. Focusing solely on appearance without considering the underlying muscle fiber adaptations and their impact on overall health and disease management would be a misapplication of expertise and a deviation from the core principles of clinical exercise physiology. This could lead to training that is physiologically unsustainable or exacerbates underlying health issues. The professional decision-making process for similar situations should involve a systematic evaluation of the client's goals, health status, and current fitness level. This includes understanding the physiological demands of different exercise types and how they recruit various muscle fiber populations. The RCEP should then integrate this knowledge to design a program that is safe, effective, and individualized, with clear objectives and measurable outcomes. Regular reassessment and program modification based on the client's response are crucial components of this process, ensuring that the exercise prescription remains aligned with the client's evolving needs and physiological adaptations.